Hi everyone, my name is Jennifer. I am a pelvic floor physical therapist with FemFirstHealth. Today I'm going to talk to you about who needs to get a postpartum pelvic PT evaluation. So every person who has delivered, whether it's a C-section or a vaginal delivery, whether you had a physically easy pregnancy or a difficult one, needs to get a postpartum physical therapy evaluation. So the reason is it's not necessarily your delivery that is the toughest part of pregnancy on your pelvic floor, it's the pregnancy itself. So throughout pregnancy, you're experiencing a lot of hormonal changes, and one of those is the influence of the hormone relaxin and the sort of loosening and softening of your connective tissue that holds your joints together. So the pelvic floor is what supports everything in the abdominal cavity, and that's going to include your growing pregnancy. So while your connective tissue is getting softer, your pelvic floor muscles are attached to your bony pelvis. As the pregnancy proceeds, the bony pelvis is also going to change a little bit. You might already be feeling that, where there's a bit of a widening in that structure. And this is your body preparing you for vaginal birth, whether that's your plan or not. And so all of these changes are natural. However, with the growing pregnancy coming down on the pelvic floor, with the pelvic floor holding on to the bony pelvis and the bony pelvis changing, you've got a lot of strain on these muscles. So doesn't matter what kind of delivery you had or what kind of experience you kind of felt you had, it's a really good idea to get checked on those muscles just to make sure that they're healthy and can continue to do their function. So the ideal time to get this evaluation is 6 weeks after the birth, or when you're cleared for internal work by your OB or your midwife. Now, say you had a child years ago, you had a pregnancy years ago, and you might be feeling some symptoms now, that's a-okay, you can come on in. These kinds of symptoms can range from anything from pelvic heaviness to difficulty holding urine, or even issues with digestion. So during a postpartum assessment, first we'll get to know a little bit about how you're feeling, how your delivery went, any symptoms that you might be feeling at that point. Then we're going to check for a few things. One, diastasis recti, which you can find other videos that we made about that, and how your abdominal muscles are coping after having accommodated for that pregnancy. Another is discussing with you any kind of orthopedic issues you might be having, whether it's lingering low back pain or ongoing pubic symphysis pain, or kind of changes in your balance. And then, most importantly, is the internal evaluation. And that's when your pelvic floor physical therapist is using one gloved finger with lubricant and is actually checking on those pelvic floor muscles. We'll ask you to contract the muscles, see if you can relax them, see what your sensation is like at that point, if there's any sensitivity or diminished sensation. And this gives us a really good idea of the function of those muscles and if there's anything that we need to do in order to better that function. So if you've had a C-section, we're also able to check on your C-section scar. So people can have different experiences with the scar tissue at the C-section. Sometimes when that scar tissue is healing, ideally, they've gone through layers in order to access the uterus. You want these layers to heal one after another. What you don't want is any kind of congestion or adhesion, and that can lead to different kinds of symptoms. Sometimes it's hip pain, low back pain, even constipation. So we can coach you through scar care, scar massage, and working on that scar so you can minimize its appearance, minimize any kind of shelf that might be happening with the abdomen coming over the scar, and taking care of any symptoms that you might be feeling in regards to that scar. In addition, if you've had any tearing or an episiotomy during a vaginal birth, then we can certainly check on that scar tissue and see if it's influencing the muscles. So scar tissue tends to be a bit stiffer and inelastic. Sometimes this can impact function or can impact sensation or be hypersensitive. These are all things that we can treat. So if you have hypersensitivity and maybe you're having difficulty returning to sex, we would be able to work on that scar tissue and help you with desensitizing it. And if that scar tissue is disrupting how well those muscles could contract and relax down, then again, that's something that we could work with you in order to correct it so that you can feel better and have full function in those muscles. So once we've done the full pelvic floor evaluation, we have an idea of how your muscles are doing, and we've discussed symptoms that you might be feeling at this point. We can come up with an appropriate treatment plan for you. For some people, they might need pelvic floor strengthening, or for many people, they actually need a lot of pelvic floor relaxation, since the pelvic floor is usually pretty stressed after a pregnancy, and then possibly followed by specific kinds of retraining, like making sure that you're able to contract correctly and relax all the way down from that. We can also talk to you about how your abdomen is feeling. If you're feeling any kind of core weakness, or if you do have diastasis recti, these are things that we can work with you to correct. And in some cases, someone might not really need any additional treatment, but it's also very important just to know if that's you or if you need something that might be preventative later on. And if you're postpartum and you're already looking towards having another pregnancy, it's important to get checked out at that point too, to see that the pelvic floor muscles are as healthy as they can be and are really going to be functioning at their best as you go into that journey. So if you're interested in a postpartum evaluation, or if you're planning on getting pregnant, you can contact us, either give us a call or go to our website. That information is below.